Classification of muscles of the trunk. Figure 4.1. 2. Section 2. The muscles of trunk. Section 2. The muscles of trunk. The muscles of back: trapezius, latissimus, levator scapulae, rhomboid muscles: erector spinae, sacrospinales, thoracolumbar fascia. The muscles of thorax: 1. The extrinsic muscles: pectoralis major, pectoralis minor, serratus anterior. 2. The intrinsic muscles: intercostals externi, intercostals interni. The diaphragm. The muscles of abdomen. 3. 4. Muscles of thorax. Muscle origin, insertion, action, innervation. Page 118, 646. Muscles of thorax. Muscle origin, insertion, action, innervation. Pectoralis major. Sternum, ribs 2 to 6. Intertubercular groove of humerus. Adduct, flex, med-rotate arm. M and L pectorals. Pectoralis minor. Ribs 3 to 5. Coracoid process of scapula. Depress, rotate scapula. Serratus anterior, ventralis. Ribs 1 to 9. Scapula. Protract, rotate scapula. Long thoracic. Muscles of thorax. Muscle origin, insertion, action, innervation. Trapezius. Page 49. Muscle origin, insertion, action, innervation. Trapezius. Ligamentum nuchae, C7T12. Clavicle, spine and acromion of scapula. Elevate, adduct, rotate, depress. Accessory. Levator scapulae. C1 C4. Medial border of scapula. Elevate scapula. D scapula. Rhomboids. C7T5. Adduct, elevate, rotate. Muscles of thorax. Muscle origin, insertion, action, innervation. Deltoids. Clavicle, spine and acromion of scapula. Deltoid tuberosity of humerus. Flex, abduct, extend, lat and med. Rotate arm. Axillary. Latissimus dorsi. Iliac crest. Sacrum, T712, lumbar fascia. Intertubercular groove of humerus. Extend, adduct, med. Rotate arm. Thoracodorsal. Anterior surface of thorax. Palpate the following. Sternum, 3 parts. Jugular notch. Sternal angle, equals second rib. Clavicle. Costal margin. Xiphosternal joint. Midclavicular line. Midaxillary line. Page 201. Posterior surface of thorax. Palpate the following. Spinners process of C7. Scapula, ribs 2 to 7. Scapular spine. Acromion process. Inferior angle of spine. Inferior border. Page 90. Locating internal structures. Pleural cavities. Inferior margin equals adjacent to T12 and posterior midline. To rib 10 at midaxillary line. To rib 8 at midclavicular line. To xiphosternal joint medially. Lungs posterior border is 2 ribs superior to pleural cavity, rib 8. Heart. Deep to xiphosternal angle. Page 206, 11. 12. 13. Pectoralis major. Pectoralis minor. Trapezius. In more primitive species used for opening and closing gills, a branchial muscle. In humans, used to move scapula and keep head up. Trapezius origin, occipital bone, spines of C7 and T112 insertion. Acromion. Spine of scapula. Lateral 1/3 of clavicle. Trapezius innervation, accessory nerve, cranial nerve 11, action. Extension of the head. Elevation and depression of scapula. Trapezius. Serratus anterior origin, first 9 ribs insertion. Medial edge of scapula's deep surface, serratus anterior innervation, long thoracic nerve action. Rotates scapula. Primitively a body wall muscle. Serratus. Anterior. Levator scapulae origin, transverse processes of C14 insertion. Medial edge of scapula. Levator scapulae innervation, ventral rami of C3 and C4 action. Retracts scapula, depresses glenoid. Rhomboideus major origin, spines of T2 T5 insertion. Medial edge of scapula, rhomboideus major innervation, dorsal scapular action. Retracts scapula, depresses glenoid. Rhomboideus minor origin, spines of C7 and T1 insertion. Medial edge of scapula. Note, minor is superior, cranial, but smaller. Rhomboideus minor innervation, dorsal scapular action. Retracts scapula, depresses glenoid. Levator scapulae. Rhomboid minor. Rhomboid major. Levator scapulae. Depression. Rhomboids. Pectoralis Minor. Elevation. Trapezius. Serratus. Anterior. Trapezius. Latissimus Dorsi origin, spines of T7 T12 thoracolumbar fascia. Insertion. Humerus, inner tubercular groove and lesser tubercular crest. Innervation. Thoracodorsal nerve. Latissimus, extends, adducts and medially rotates humerus. Pectoralis, is large, fan-shaped muscle opposing it ventrally. Pectoralis major, clavicular head, sternal head. Origin, inferior margin of clavicle. Insertion, deltopectoral crest of humerus. Sternal head. Origin, ventrolateral margin of sternum. Pectoralis major, clavicular head. Origin, inferior margin of clavicle. Insertion, greater tubercular crest of humerus. Innervation, medial and lateral pectoral nerves. Pectoralis major, sternal head, depressor, adductor of humerus. Origin, ventrolateral margin of sternum, costocartilages 1 to 6. Insertion, greater tubercular crest of humerus. Innervation, medial and lateral pectoral nerves. Pectoralis minor, deep to pec. Major origin ribs 3 to 6. Insertion, coracoid process of scapula. Innervation. Function, stabilization of scapula. Positionally important for understanding location of other structures. Elevators has major origin, lower edge of scapula. Insertion, lesser tubercular crest. Action, extends, adducts and medially rotates humerus. Innervation, lower scapula. Elevators subscapularis origin, deep surface of scapula. Insertion, lesser tubercle. Action, medially rotates humerus. Innervation, upper and lower scapula. Internal view. Subscapularis. Elevators has minor origin, lower edge of scapula. Insertion, greater tubercle. Action, laterally rotates humerus. Innervation, axillary.